All right. Roll up to a patient. First thing, scene safe, BSI, put the gloves on. Appears to be one patient. Mechanism of injury, falling from a couch. First thing we're gonna do, check for a pulse. Make sure he doesn't need CPR. He has a pulse. Partner's gonna hold C-spine. Palpate down the cervical spine. It's all good. Put a collar on. We're gonna call for a medic to the location and go into our primary assessment. Before that, we're gonna see if he's alert. So, hey, can you hear me? Anybody? He doesn't answer, see if he's responsive to painful stimuli. He's not, so we go into our primary. So first things first, airway. So he's gonna jaw thrust, open his mouth. We're gonna inspect the mouth to see if he needs any suctioning or whatever. It's not self-maintained, so we're gonna put an OPA in. If he rejects that, you're gonna put an NPA in. We're gonna go down to breathing. We're gonna listen to his lung sounds. All right, he's breathing shallow and labored, so we're gonna ventilate with a bag valve mask. Then we're gonna go to C. We're gonna check his skin. He's cool, pale, and moist. We're gonna check a pulse. He does have a pulse, but it's weak and thready. We're then gonna check for bleeding. Palpate down big pipes, little pipes, back, torso, whatever, no bleeding, he's good. At this point, we're gonna load and go. So, because he needed to be ventilated and it's suspected that he has symptoms of shock, not suspected, he does have symptoms of shock. So we're gonna call him a high priority patient and load go. We're gonna flip him on his back, throw a sheet under him, throw the backboard under him, get him on the ambulance, get him on the stretcher, put the stretcher on the ambulance. At this point, we're in the ambulance. We go into our secondary assessment. So, first thing, we're gonna do a head to toe. Start at the head, palpate the skull, the facial bones, check the holes. So this ear, there's no fluid. Check the eyes, see if the pupils constrict to light. Check the mouth again, make sure there's nothing that needs to be removed or any teeth that fell out when you're moving him or whatever. Any obstructions. We're gonna check the nose, make sure there's no bleeding. Seem to be good. We go down to the neck, we palpate the neck, make sure, check for any tracheal deviation, any distension in the veins in his neck. We're good. Then we move down to the shoulders, palpate the shoulders, palpate the clavicles, check down the sternum, I guess. Go in with the ribs and down, palpate the ribs, whatever, we're good. We go down to the abdomen, palpate the abdomen, make sure there's no distension, bruising, whatever, bleeding, we're good. We go down to the pelvis, the hips, whatever, we push in on the hips and down, we're all good there. We check the pipes on the way down, little pipes, check his arm, he's good. His hand, PMS, obviously he can't respond to MRS, so we're just gonna check the pulse. He has a pulse. Same thing over here, palpate down the arm, check PMS over here, he has a pulse. We are going to go down the leg, palpate down the leg, check for a pulse over here, he has a pulse. Same thing over here, he has a pulse. We're going to check the back. Oh, I forgot the genitals. We're gonna check those. Flip him over. It looks like he's good down the back. Palpate down the spine. There's no crazy deviations in the spine or, I don't know, bones sticking out. We're good. Check for any bruising behind the organs. We're good. We're good there. So at this point, we're going to probably treat him for shock because of his weak and thready pulse, his skin, and him not being able to breathe. So, or having trouble breathing. So we're going to keep him warm, transport, oxygen, and shock position. So we're going to attach the oxygen to the bag valve mask at 15 liters per minute. Then we're going to go and we're going to check the vitals. So we check his blood pressure. Kind of hard to do on this, but you know, check his blood pressure. If his blood pressure was high, you would suspect some kind of maybe head injury or internal bleeding or something. We're going to check his breathing again, this time in 6 planes. So whatever, now we're ventilating him, so you know he's breathing at 12 breaths per minute, and he's ventilated. We're gonna call the hospital and call in the trauma report. We have one patient who fell from a couch. We're treating him for signs of shock right now. The patient's been ventilated with the bag valve mask. We have a collar on him, and his vitals. Yeah, I forgot to check the pupils and his skin again, but whatever, it's a mistake. His vitals, whatever, explain the vitals, high blood pressure, low blood pressure, whatever. And then just reassess your interventions. It's a high priority patient, so make sure you recheck the airway. Check the primaries, check the check any interventions, and yeah, transport him to the hospital, and we're all good.